Hello, everyone. Welcome to another TGIF episode of the Anti-Pharmacist podcast. Well, today I'll be talking about the topic insomnia, and I'll be asking the question and answering by myself, of course, that are sleeping pills the answer? Many people experience insomnia at one point or the other in their lives due to many reasons, which I'll be discussing. And a lot of people have the idea that if they don't use sleeping pills, they cannot get over it. The moment you have sleep problems like this, you just start looking for medications to induce sleep. So I want to answer that question today to let you know if sleeping pills are the answer or there are other options. So let's get right into it. So first, we would define insomnia, right? And what is insomnia? It is simply a sleep disorder in which you have trouble falling or staying asleep. And it can be both. You can have trouble falling asleep as well as staying asleep, or it can be either. You see? And this condition can be short term, it can be long term. For the short term or acute insomnia, it lasts from one night to a few nights a week, okay, or to a few weeks. While the chronic insomnia lasts for longer and it happens at least 3 nights a week for 3 months or more. Okay, now insomnia can come in different forms, okay, but there are two major types, the primary and the secondary. Primary insomnia means that your sleep problems are not linked to any health condition or problem, while secondary insomnia means that you have trouble sleeping because of a health condition, which could be asthma, depression, arthritis, cancer, pain, medication use, or even substance abuse like alcohol. Okay. Also, apart from the types of insomnia, there are different stages, or what should I call it now? There are different phases of sleep disturbances. There's sleep onset insomnia, that is, you have trouble even sleeping in the first place. Then there's sleep maintenance insomnia, which happens when you have trouble staying asleep through the night, or maybe you wake up too early. You see, there's also missed insomnia, in which you have trouble both falling asleep and staying asleep through the night. So that's the mix of sleep onset and sleep maintenance insomnia. Then there's paradoxical insomnia, in which you underestimate the time you are asleep. You see, you feel like you sleep a lot less than you really do. Maybe you slept for hours, but when you wake up, you feel tired as if you have not slept at all. So those are the different types and classification of insomnia. Now, the causes of insomnia. There are primary causes, there are secondary causes. Loss of job, change of jobs, depression due to loss of a loved one, divorce, all those things that could cause you stress. It could be also due to pain or discomfort at night. It could be due to your consumption of caffeine, tobacco, or alcohol use, as well as use of illicit drugs like cocaine, like heroin. Then it could be due to endocrine disorders like hyperthyroidism, or other sleep disorders like restless leg syndrome, sleep apnea. Sleep apnea is inability to breathe well while in the sleeping position because your windpipe, your airway has been blocked some way. You see, it could be due to pregnancy even. Some people's body change, different hormones are running around in your body during pregnancy, and so it could cause your inability to sleep very well. It could also be due to Alzheimer's disease and other types of dementia. It could be due to premenopausal syndrome or even menopause. And lastly, attention deficit hyperkinetic disorder, known as ADHD. All of these are secondary causes of insomnia. Okay. And they are related to the risk factors for insomnia, the things that could predispose you to insomnia, like long-term illness. When you're dealing with chronic illnesses, it could be mental health issues, anxiety, depression, and the likes. Then working night shifts or shifts that rotate. If you do nights consistently for a while and you have not been sleeping at night, once you get off that shift, it might be difficult for you to actually go back to sleep normally. Okay, so insomnia is just like a disruption of the normal circadian rhythm of the body. There's a time the body should actually be at rest and you should go to sleep. And there are different stages of sleep. Okay, the REM, the NREM, and the likes, but we're not going into that. Okay, now onto the symptoms of insomnia. Some of them are feeling sleepy during the day, fatigue, tiredness, because you were not able to sleep at night. Now you will definitely be tired in the daytime, feeling sleepy, you'll be grumpy, you'll not be able to concentrate, or you may start forgetting things. You have problem with concentration or memory. So those are symptoms of insomnia. Now to treatment. There are many treatment options, alright? So what we're examining today is, are sleeping pills the answer? Most people, they just go straight. Once they feel like, I've not been sleeping well, the next thing is, let me go and look for a sleeping pill, medication, and just put me to sleep. But the thing is, well, they may or may not be the answer, depending. If you have chronic insomnia, for example, and you go see your healthcare providers, they would have at least given you the first line treatment, which I'll be getting into later, before giving you medications. Medications should actually be the last resort and not the first. So I'll just be mentioning the different sleeping medications, which most people know, of course. The likes of your benzodiazepines, your lorazepam, your bromazepam, diazepam. Those are the common ones. We have zopiclone, we have zolpidem, okay, we have nitrazepam. All of those are the common sleeping medications. Also, antihistamines can serve as sleeping medications. The likes of your chlorpheniramine pyridine, your diphenhydramine, they are used also as sleeping medications. Then there are supplements like melatonin. It's an hormone that regulates sleep in the body. It can be taken externally so that the body is reset back to the normal sleep cycle. So these are normal, common sleep medications. But then they should not be your first resort. Like I said, they are not the answer like that. Whether they are the answer or not to your insomnia depends on the type, like I said, either acute or chronic, and the cause of your insomnia. Acute insomnia might actually not need treatment. You just have to adopt some healthy lifestyle changes and your normal circadian rhythm will return, because taking sleeping pills at the slightest absence of sleep may actually lead to undesirable effects like excessive drowsiness, impaired thinking, night wandering, what they call narcolepsy, agitation, even balance problems. Some can even cause rare side effects like allergic reactions, face swelling, and unusual behaviors like driving, cooking, or eating while sleeping. Antihistamines, which are over-the-counter sleep aids, like I've mentioned earlier, the likes of your pyridine, your diphenhydramine, also have their own effects like daytime drowsiness, dry mouth, blurred vision. Okay, so sleeping pills may be the answer for those that have chronic insomnia, but they are still not always the answer. The best approach is to adopt healthy lifestyle changes. Okay, first, don't smoke. Avoid or reduce alcohol and caffeinated drinks. Exercise regularly. Maintain healthy diet. Don't drink too much fluid before going to bed. These are the first things to do to actually prevent insomnia, amongst other things like going to sleep at the same time every night and getting up at the same time each morning, so that your body gets used to that clock. Okay, it's like you resetting your body clock. Then try not to take naps during the day, because they may make you less sleepy at night. Try not to use your phones or ebooks before bed, because the lights entering your eyes may make it harder to fall asleep. Even if you exercise, try not to work out close to bedtime, because it may make it hard to fall asleep, because your heart will actually be beating faster. So exercising should be at least 3 to 4 hours before bed. Also, don't eat heavy meals late in the day, like very close to your bedtime. Eat a light snack before bedtime. It will help you sleep, because your body has to process whatever you eat before you can actually go to sleep. Then make your bedroom comfortable. Make it dark, quiet, not too warm or too cold. If you can't sleep with the light on, use a sleeping mask or put the light off. Then try to prevent sounds from entering your room. You can use earplugs. You can cover your fans. You can use your AC instead of using fan inside the room. Okay, just follow a routine to relax before bed. You can read a book. You can listen to music. You can take a bath. Then try not to use your bed for other purposes apart from sleep and sex. And if you can't fall asleep or you are not drowsy, get up and do something calming, like reading until you feel sleepy. Then if you tend to lie awake and worry about things, just try to take your mind off it. Make a to-do list before you go to bed. At least that may help you put your concerns aside for the night. When you do all of this, it will help, your body to relax just before bedtime. The first line of treatment of insomnia, even before medications, is behavioral therapies, in which one is taught how to make the environment more conducive to sleep. And they have been shown to be as effective or even more effective than sleep medications. And these behavioral therapies include relaxation techniques, cognitive behavioral therapy, sleep restriction, light therapy. Relaxation therapies like massages, like muscle relaxation, like breathing exercises, they help you lower anxiety at bedtime, and they help you control your breathing, your heart rate, your muscle tension, so that you can actually relax and so that sleep may come. For cognitive behavioral therapy, what they do is to help control or stop negative thoughts and actions that keep you awake. Okay, the strategies that they use, like stimulus control, helps to train your mind and body to sleep better and not to fight sleep. Sleep restriction is also used. Sleep restriction involves reducing the time you spend in bed, like restricting napping in the daytime, like I said, so that you're more tired at night and you can sleep. Then light therapy involves using light to push back your circadian rhythm, like this, your body clock. You can go outside when it's light outside in the evenings. You can use light boxes. All of those things are included in light therapy. Okay, you see, insomnia can also occur in children, and all of these strategies that I've mentioned are best even in children, because it's not advisable for you to say because a child is hyperactive you're giving them sleeping medicines. I've talked about drug use in pediatrics, and most of these medicines are not safe in children, you see. So it's best to use all these behavioral therapies, reading them bedtime stories, setting a sleep schedule for them, a time that they must go to bed, making the bedroom conducive for them to sleep, reducing noises in their bedrooms, all of that will help them to sleep. Then reducing nap times in the afternoons. All of this will help the child maintain a good circadian rhythm and to sleep well, help to prevent insomnia in the child. And if the child is suffering from ADHD, for example, then you could use medication for that condition, because that is actually the cause of the insomnia in the first place. You understand? Just like in adults, some are caused by diseases. The first thing is to treat the cause, not just the symptom. A lot of people attack insomnia itself with medications, forgetting the causes. The causes like stress, like mental health problems, like chronic diseases. These causes are what we should address first before going for sleeping pills. Okay? So the summary of my discourse today is that you should not be quick to jump at sleeping pills. Some people can go to any length to get sleeping pills. Some are already addicts. In fact, they will beg at the pharmacist, please give me just one or two. In another few days, they are back. Some will manufacture symptoms, for doctors, just for them to write these medications for them, when in fact they can train their bodies through all these things I've talked about earlier to sleep naturally. Going and hustling for sleeping pills is the lazy approach to treating your insomnia. Why not explore the root cause of the insomnia first, or other forms of therapy, before taking medications as a last resort? There's really nothing like sleeping naturally. You'll be more relaxed and it will cost you nothing. So why not adopt healthy sleeping habits and diet too? And your body will thank you for it. Also, do not wait till you have insomnia to cultivate these healthy sleeping habits. I've told you that you can use them both as preventive methods and as treatment methods for insomnia. it will pay off in the long run, really. And that is what I have for you on today's episode. Thank you so much for listening up to this point. Let me use this opportunity to say that on Monday will be the last episode of the drug use series, where I'll be talking about drug use in geriatrics, that is in older people. Okay, and that will be the last episode of season 2, after which I'll be taking a short break to come back powerfully for season 3. Thank you guys for staying with me up to this point. I can't lie to you. Sometimes it gets overwhelming, with life situations and circumstances and other things that I have to do. But your support keeps me going. When I remember the comments that I read from someone, how they were educated, how they learned a lot, I just can't help but, put in my best at every point in time. So I'll need this support even going forward. Please like, share, subscribe, do all of that for my podcast. Please follow me on Instagram, on LinkedIn, on X. For now, I'm the only one handling all of the processes of this podcast. So, like I said, it has not been easy. Please just understand with me. I may not be very active on all social media platforms, but I try as much as possible to post something about each episode on at least 1 or 2 of these social media platforms. So please follow, like, repost, and do all of that for me. Help me share so that more people will be aware of this, and it will benefit a lot of people. That the information I share here, they are premium. I try to explain as much as possible so that even the layman would understand. And there are chances for you to actually comment, to ask your questions as well. Like I said, I'm always ready to answer you. You can also contact me via my mail at antipharmacistpodcast@gmail.com, for any collaborations, for anything that you might want to tell me that you don't want to put on those social media platforms. I'll be sure to also reply you on that. Thank you so much, guys. Once again, I can't thank you enough, really. And I say till next time, stay healthy and God bless you.